So now I invite Dr. Anil Shah, sir, to discuss his snare technique for cataract removal.
Good evening. Today we are presenting Magic of SICS Snare, a revolutionary approach to cataract surgery. I am really very much thankful to the office bearers and organizing committee of APOS and AIOS for inviting me as a speaker. Now, the ultimate aim of any cataract surgery is that incision site should be close to phacoincision. We are almost competing phacosurgery. So if our incision is close to phacoincision, then the technique of SIC is much greater. The technique should be simple, it should have minimum learning curve, and it should divide all grades of cataract. Now, cataract surgery is no longer a rehabilitative procedure, but it is extremely precise procedure, and it is a refractive surgery. And our aim is emetropia with multifocality and phaco-free MSICS. Now, snare technique can be indicated for all types of cataract, whatever the type of cataract you label, you can do with the snare technique. And last is when there is a phaco machine failure, you can do a snare technique also. This is my snare design, which I am using for last 35 years, and this is the same snare which is practiced by me, and it is used by all of us. Now, the special feature about a snare technique is that it has got two holes at the tip, which are very useful. Because of these two holes, the loop size can be adjusted. Intraocular rotation is possible. Intraocular movement is possible. Easy engaging of the nucleus is possible. You can divide any grade of nucleus. There is a safe division. And another thing is that it can be autoclaved multiple times, so the snare can be used many times. Now, when to avoid snare is also an important factor. When the eyeball is hot, there is a positive pressure. If nucleus is not free floating into the anterior chamber, if AC is not adequately filled, and if AC is shallow, if there are intraocular movements are present, and if the surgeon is confident. Always use snare with OVD, do not use with BSS or saline. Now, there is some unknown fear for snare technique. There is a common fear, some misconceptions are there, some misinformations are there. Some think that there is steep learning curve, some think that it can damage cornea, posterior capsule, or iris, and some think that there is limited control on the procedure, and some fear is unknown. But actually, it is one of the most safest surgery. There are many advantages of snare technique. I will not go into the detailed advantages because this is one of the best technique for delivering any grade of nucleus through a smaller incision, so it has got very multiple advantages. The unique feature of snare technique is that the snare is the only instrument that can give a longitudinal division of any grade of cataract, and a complete division of the posterior plate is possible at one go. Now, snare versus there are many pre-choppers are available. The nucleus division by pre-chopper is pie-shaped, so the size of incision is more. But here in snare, you get a longitudinal division, so you can take the nucleus pieces to a very small incision. In pre-chopper technique, there is a risk to bag zonular dehiscence or precedent, but it is safe with the bag zonules and precedent. And posterior plate is difficult to break with the pre-chopper, but it is easy to break posterior plate with the snare technique. And snare technique is in the safe zone, while pre-chopper is in a risky zone. Now I'll show you the video. This is my routine way of doing transconjunctival limbal tunnel incision. Normally I use 3.5 millimeter to 4 millimeter. External incision is smaller and internal incision is little wider. The nucleus is prolapsed into the anterior chamber. It is made free floating into the anterior chamber. It should not be attached to any intraocular structure. OVD is filled around the nucleus, below, above, and in the sides, so as to make the nucleus stable. Now the snare loop is made shorter according to the size of the nucleus. The loop should be of adequate size. If the loop is big, then it can damage endothelium. If it is small, it will not engage the nucleus. The loop encircles the nucleus and divides it in a fraction of a second, and you get a two clear-cut division of the nucleus. The two halves are separated. Normally, I remove all these types of nucleus with a simple plain McPherson forceps. A thin long McPherson forceps is sufficient to remove all these types of nucleus. There is no damage to endothelium, no damage to posterior capsule or even the tunnel, and you can safely remove the nucleus with the McPherson forceps. The another half of the nucleus is brought into the center. Many things that a snare can touch the endothelium, but it is not so. It is very safe to the endothelium. Now this is an intimation cataract. These types of cataracts are also very difficult to manage with the other methods of cataract surgery. Now with the snare you can divide this nucleus easily, and the incision size is almost 3 to 3.5 millimeter. So you can take out this type of nucleus very easily. This is a very small nucleus. I have removed a core embryonic nucleus. Almost all the EP nucleus is not there. So this type of nucleus you can divide it into two incision or two fragments or three fragments. This is a very big nucleus which is occupying whole of the anterior chamber. These type of cases are also very difficult to manage, but with the snare technique you can do bisection and trisection and remove through the smallest incision. See, this is one fragment is done. Now the snare is engaging the other half of the nucleus, and the nucleus is divided into three fragments. Here it doesn't touch the endothelium or even to the posterior capsule. Now these fragments are removed by the McPherson forceps easily. This is a middle fragment, and you see the incision size is almost 3.5 millimeter. So with this we can do all premium IOLs, all types of cataracts, and you get a good results in multifocal and trifocal IOLs also.
Here in this video, I will show you how the snare can be used.
Here is quadrisection is done.
4 sections. Here in this video, I will show you how the snare can be used to divide nucleus into 4 sections, quadrisection. Now, normally quadrisection is not routinely practiced, but if the nucleus is very hard and if you want the incision size should be less than 3 millimeter or 3.5 millimeter, then you can use snare to divide the nucleus into 4 segments. Normal nucleus size is approximately 9 to 10 millimeter. So after 4 division, the size of the nucleus becomes 2 to 2.5 millimeter, which can be easily removed through a 3 or 3.5 millimeter incision. So your incision is close to phaco incision, and you get all the benefits of phaco incision. See here, after division, the nucleus fragments are being removed by McPherson forceps. This is the last fragment which is removed. In this another case where I was supposed to do trisection, so I did a first section and divided the nucleus into 2 halves. The other half of the nucleus is big, so I thought of dividing it again into another fragment. So this is another section and the nucleus fragment is divided. But when I tried to remove this fragment, it appears to be slightly bigger than the size of the wound. So I again divided it into another section, and that way 4 sections are made. And these 4 fragments are removed through 3.5 millimeter or 3 millimeter incision with the McPherson forceps. This is very simple, safe, and a good technique for all types of cataract, and it can be removed through smallest incision of 3.5 millimeter.
So these are the post-operative cases after day 1 or in 1 week, and I have done almost 25,000 cases of with the snare technique. Initial difficulties are there like corneal edema and descendant memory detachment or hyphema, but with the practice they subsides. There is no PCR or no nucleus draft. You can do it in this surgery in 10 to 15 minutes, and the recovery time is also 2 to 4 hours. Patient can be discharged in 2 to 4 hours. So it is as good as you are doing a phaco surgery. So in conclusion, it is a revolutionary approach to cataract surgery, precision and safety and efficiency to make it invaluable tool. My presentation has inspired you to explore this technique and incorporate in your practice. Together, we continue to push the boundaries of what is possible in eye care to improve vision of our patient worldwide. Thank you.
Thank you, Dr. Anil Shah, for giving this elaborative demonstration of nucleus management through the snare technique.